The world commemorates Cervical Cancer Awareness Month. Kenya has reported a remarkable increase in the uptake of the HPV vaccine, even as the country gears up to achieve the 90 to 70 to 90 World Health Organization targets by 2030. Screening has also been cited as one of the best preventive measures. But just how is the screening done? Our health reporter, or health and science reporter, that is Elizabeth Atino, spoke to a medical microbiologist as well as an atomic pathologist and filed this report.
As the sun rises and sets, Kenya loses 9 women to cervical cancer each day. This translates to 3,211 deaths annually, making it the second leading cause of cancer-related deaths reported in Kenya every year. 5,236 new cases of cervical cancer are diagnosed annually. This type of cancer has equally been marred with stigma considering its mode of transmission, which is through the human papillomavirus HPV transmitted through sexual contact. Other causes include poor hygiene, low immunity due to HIV, excessive smoking, and obesity.
Cervical cancer, cervical cancer, and this journey it started 2015. But I want to thank God because I had that positive heart. I knew that I must live.
HPV accounts to 70 to 80% of cervical cancer causes. This therefore brings to light the importance of conducting a HPV test. It is estimated that 80% of people will have at least one type of HPV infection during their lifetime, with 10% progressing to the cancerous stage. The human papillomavirus takes about 10 to 15 years to develop in the body. Hence, screening and vaccination are said to be the only remedy at the moment. And so we visit a medical laboratory here in Nairobi to understand just how the HPV and pap smear tests are conducted. But even before we get into the procedure, Zelifa Gitari, a medical microbiologist at Pathcare Kenya Limited, expounds on the importance of a HPV and pap smear test for cervical cancer. And most importantly, the right age to take the test.
For the pap smear and also for the HPV, they both are, you start once the female starts to be sexually active, so mostly from the age of 21. Not all HPV virus will lead to cervical cancer.
It's recommended to do it annually up to around 30 years old. And if they are normal up to then, after 30, you can do it 2 to 3 years using the conventional method which we do.
HPV test entails the collection of a sample from the cervical area, which is examined for the human papillomavirus. The HPV test avails an option for the self-collection kit, which means one can conduct the test at the comfort of their home. The sample is then taken, picked by a healthcare professional for lab analysis.
Once it's inserted into the vaginal area and opened up, we are able to visualize the cervix under a very good source of light, of course. And once we do that, we collect the sample in a series of areas that we are looking at. Basically,
after the sample has been taken, it will be put on a slide like this. Then it will go through a process of staining. Now we put it under the microscope, then we screen it. So we'll go from one point, we go down, up, down, up. Basically, we look at the whole slide.
The results for the HPV test may be available within a day, while that of the pap smear test may take at least 7 days.
If it is positive, then they say they have seen some abnormal cells, and then they're going to be able to now give you the report according to how they are seeing those abnormal cells.
The treatment for cervical cancer varies with the tumor stage, whereby a surgery and chemoradiotherapy is preferred during the early stage, and chemotherapy targeted therapy and immunotherapy is targeted in the advanced stage.
Then in histopathology, we have cytology and histology. Pap smear falls under cytology. Cytology means cells. You are looking at cells. So there are different tests. You can do a pap smear, a fine needle aspirate, you can have fluid from your body. All those will fall under cytology because you'll be looking at cells. You're not looking at a piece of meat which has been taken away from the body. In histology now, you are looking at when a biopsy has been taken now. So either you've had surgery and they've removed something and it has to be looked at.
Some of the symptoms of cervical cancer include vaginal bleeding, pain during intercourse, pelvic pain, and change in vaginal discharge accompanied by a strong odor.
If you have all those symptoms, you should get it. But remember, it's not you should go to a clinician. They should have a look at you. Then they can decide to do it.
HPV vaccination, which commenced in 2019, targeting 10 to 14-year-old girls, has been cited as the cornerstone for prevention of cervical cancer. The Gardasil HPV vaccine is administered in 2 doses, 6 months apart. According to the National Cancer Control Program, NCCP, the uptake of the HPV vaccine has increased from 15% in 2021 to the current 38%.
So it is something we should embrace. And I think as a country we have embraced it because I know some schools which have that program going on where they are vaccinating the young girls.
Counties with a high rate of HPV vaccine uptake include Nyamira, Siaya, Kirinyaga, Kwale, Migori, Bungoma, and Makueni, while those in the northeastern region have recorded a low uptake of the HPV vaccine. On Monday, the 29th of January 2024, all roads will lead to Matunge grounds in Taita Taveta County for the commemoration of Cervical Cancer Awareness Month, led by the Ministry of Health. In January, the world observes Cervical Cancer Awareness Month. This year's theme revolves around the mantra, learn, prevent, and screen. Elizabeth Atieno, TV 47.